My name is Olivia Altamirano, and I'd like to introduce you to the article you're about to read on risk and resiliency factors related to the mental health of dementia caregivers. First, I'd like to say that it's very likely that you'll interact with people with dementia at some point in your life. Life expectancy is increasing, and because advanced age is the strongest predictor for dementia, one important implication is that rates of dementia are rising exponentially. So, whether that's on a professional or personal level, or maybe both, I think learning about this illness and the toll that it takes not just on the patients, but the family members as well, is important. You might be thinking, we all forget things. And while it's definitely true that we all forget things, it's important to understand that dementia is much, much more than that. Imagine your mom invited you over for dinner and made chicken soup, but when she served it, she added a scoop of ice cream. Imagine you called her and she was rude and hung up the phone because she didn't recognize you. Imagine she wandered out of her house and you couldn't find her for hours until eventually the police called you to tell you she was found inside a stranger's home. These are the kinds of experiences that place people with dementia in vulnerable and unsafe conditions, and these concerning behaviors, as you can imagine, make it very difficult for family caregivers to cope. This paper focuses on the effect that caregiving has on the mental health of the caregiver, because their health is important but often gets overlooked. To study how family and patient factors influence caregiver mental health, we analyzed data from 106 caregivers representing 23 of the 50 states. We used a regression framework within structural equation modeling to examine expressed emotion, family functioning, and symptom severity. Expressed emotion refers to criticism, hostility, and emotional over-involvement from the caregiver towards the care recipient. This was of primary interest because high emotional over-involvement and high criticism are strongly related to worse patient outcomes in many conditions, including dementia. So, if this was significant, targeting these could lead to improvements for both patient and caregiver. In addition, while this is typically examined as one construct, we were also interested in how each subcomponent, that is, emotional over-involvement and criticism, related to caregiver mental health individually. A latent variable was used to examine family functioning, which included measures of communication, flexibility, and cohesion. With regard to symptom severity, we used a global clinical dementia score that included domains such as orientation, memory, and judgment. Last, a latent variable was used to examine caregiver mental health, which included measures of anxiety, depression, and stress. Here, you can observe the model as a whole. The benefit of this comprehensive model is that it'll tell us whether each factor is significant, even when accounting for the significance of other factors. We expected that lower levels of emotional over-involvement and criticism, better family functioning, and lower symptom severity would be related to better caregiver mental health. All of these factors were significantly related to caregiver mental health, even when accounting for each other's significance. As expected, less criticism and emotional over-involvement and better family functioning were related to better caregiver mental health. Interestingly, higher symptom severity was related to better caregiver mental health. One hypothesis is that more symptomatic patients are also more docile and easier to care for, but that point requires further research. Caregivers do so much for their loved ones, and their efforts help society as well. We need to be better prepared to help them. So, what's next? Developing family-centered interventions that focus specifically on promoting family cohesion and reducing detrimental attitudes, such as emotional over-involvement and criticism, could help improve not only patient well-being, but also caregiver mental health, perhaps even with implications to improving the mental health of the family as a whole. We hope you enjoy the paper. Feel free to contact us with questions. Thank you.